Hi there, I'm 56 years of age and I've experienced 10 years of unbelievable pain resulting mostly from initially, the problem of having Morton's neuroma, which is a nerve that was actually causing me a huge amount of difficulty under my right foot. I did have that removed, but I think the constant pain of having that and potentially not standing straight had actually then caused other problems into my hip and my spine, and resulting in which in the last 3.5 years I've had unbelievable pain coming down my, first of all, my left leg and also lower back pain. I've actually found out that this was a lot to do with having had many CTs, mostly to do with the fact that I had issues with my slip disc, and I had issues with my moved vertebrae, and essentially all of this was causing, with my hip moving as well, causing problems, mostly down to the fact that sciatica, stopping me able to do everyday things, from picking anything up to driving, having spikes of pain which were number 10. Some of them actually would literally and did floor me completely. I run my own business, so it was a real difficult mindset to actually deal with the pain and to actually at the same time carry on a normal life. And so basically over that period of time, and in particular the last 3.5 years where the pain escalated to not being able to operate a normal life, I found that I've had chiro, I've had physio, sports massage, and literally everything of the natural remedies. Then I moved on to injections. I had 6 different kind of injections, some under anaesthetic, all cortisone of different types, did nothing for me. I basically then moved on to rapnotherapy, which is a catheter, still cortisone of some sort, but actually injected via a catheter to go even deeper. That was the only thing which did give me some temporary relief, maybe 3 months of reducing some of the sciatic pain. But on my left-hand side, it literally then did reduce to the fact that then it moved to my right-hand side, which is a bit weird. So for 1.5 years, the pain on the left suddenly moved to the right, but then it was very extreme. I could hardly walk properly, literally could only just about barely get up and go to work, but with pain throughout the whole day. So my whole life was just at zero. Nothing was possible. Even going on holiday was huge drama. And basically I didn't know what to do until I then decided I had to get to more significant and more severe, potentially an operation to actually get something to help me. So I went to see a consultant, a surgeon at Harley Street, and basically he advised that I would need major surgery. It was a lot to take in. Essentially he was talking about doing a 2-level fusion, and it was talking about I'd need a cage at the back of my discs, and essentially it was all to actually then fuse discs and do things which sounded, hugely deep and invasive to me, and it would mean that essentially not only the 6 months recovery and running my own business, that's pretty difficult to see I could have done that, but at the same time it would probably restrict all my movement. With that in mind, I was very unsure, and I didn't know what to do, so I sought a second opinion. I went to see Professor Dr. Ranganathan, and he advised that there was alternative with new technologies, and basically I sit here today having had an operation which has transformed my life. I mean, it's essentially, I had compression on the nerve, which he's decompressed that nerve and removed not only the pain, but by actually removing it away from the area that was all damaged and compressed, and also taken away from the ligament. I've already, this is not even just 3 weeks, 2.5 weeks, I've got no spikes of pain that I used to have every day, and several times a day. I have no major sciatica at all. I've just got some little referred pain, which I think is normal. I think is part of memory retention. But at the moment, although I'm still in recovery, and literally it's just over 2 weeks, I'm finding huge benefit. And I've personally wanted to thank the professor for what he's done, because it's transformed my life. I mean, I was literally not able to live a normal life, and so far I'm reporting fantastic news, and this is only 2 weeks. If I can carry on with therapy and whatever else I need to get myself to where I was, I'm going to live again, and that's all I can say.